An epidemic has found its way to Indiana. The first human case of the Zika virus confirmed just hours ago by state health officials. RTV6's Eric Cox has spent the morning learning new information about the findings. He's live now with details for you. Eric.
Yeah, I'm here at the State Department of Health downtown in the very room where officials just wrapped up a media availability that we aired live on HTSN. Take a look at those two chairs. That's where Dr. Jen Brown sat just a little bit ago, and she explained to us that the person infected recently traveled to Haiti, and it's believed that they contracted the disease during that trip. Now, at this time, the department isn't disclosing any information about the patient, including their name, age, or gender, because of privacy concerns. I'm told that the patient had a mild illness and has since made a full recovery. Now, additionally, the patient was not a pregnant woman, meaning there was no worry of a developing fetus being affected by the virus. Right now, there is currently a Zika epidemic in Mexico, the Caribbean, as well as Central and South America. The virus is usually spread to people through mosquito bites, but the CDC has also reported cases spread through unprotected sexual contact with an already infected person. The scary part is that most people who contract the virus won't showcase any symptoms, but those who do are most likely to experience a high fever, rash, joint pain, as well as pink eye. Right now, there is no vaccine or treatment for the Zika virus, and that's why doctors are urging anyone visiting those aforementioned affected areas to take steps to avoid mosquito bites. They mentioned that you should wear long-sleeved clothing and long pants to reduce the amount of exposed skin, and to stay in places with air conditioning and windows with door screens to keep the mosquitoes out. You're also asked to use Environmental Protection Agency registered insect repellents and to treat your clothing and gear with permethrin. We talked to Dr. Jen Brown, and she tells us that Indiana residents can rest assured when it comes to contracting Zika.
At this time, based on current information, we believe the risk of a Zika virus outbreak occurring within the state of Indiana is low, but we're, through our ongoing surveillance efforts, we're monitoring the situation carefully, and we'll keep the public informed if we feel like the risk profile is changing.
And if you have traveled to any of those areas I mentioned that are currently experiencing the epidemic, Mexico, Central and South America, including the Caribbean, and think you may have contracted the Zika virus, you are asked to call the State Department of Health for consultation. For now, we're live inside the State Department of Health building in downtown Indianapolis this noon hour. Eric Cox, RTV6.
Thank you, Eric. I have more details for you. Governor Pence also released this statement late this morning saying, quote, Hoosiers can be assured the Department of Health is working diligently to study the latest information on the Zika virus and will be proactively keeping Hoosiers informed in the weeks and months ahead. Of course, our coverage continues on the RTV6 app and on the Now Indy at 4 o'clock.